we're going to do is talk about the male anatomy. You know, the same issues there we are concerned about. So we have now kind of got Melvin ready to go. I'm going to cover him just like I would the female. I'm going to focus on doing the upper pubis area first, just like I did with the female. And in case you haven't watched that, we're going to repeat that step just a little bit here. So I've already given the bed bath to this point, and now I'm doing a pericare. So again, we're going to do this upper pubis area as far down as we can reach. I'm going to bring this towel down. As far down as we can reach. Soap, rinsing, and pat drying. Remember, what we wash, we rinse. What we rinse, we dry. Okay. All right. So now I've used that same little technique to keep him covered. I think I'm going to put it like that. There we go. It's going to be a little awkward, but for simulation purposes, we'll make it happen here. All right. So again, I'm going to keep him covered also. I don't want him exposed either. We would have checked that water temperature if it had changed. We could go ahead and get some warmer water at this point. Get some soap on that. Now, there are some challenges with the male anatomy also. Now, Melvin here happens to be uncircumcised. So we're going to talk about an uncircumcised penis. So the first thing I'm going to do is, as I pull back I'm going to pull back the foreskin all the way to where it reaches past the head of the penis. I'm going to focus on holding the shaft of the penis. And again, we're concerned about his urinary opening, just like we were the female. We moved away from the urinary opening, so we did not bring bacteria into that area. Same thing with males. We're going to start at the head of the penis, go around in a circular motion, all the way down to the shaft of the penis. Okay, that's washing. Then we're going to rinse. Here, Melvin, keep it warm while I do this. Going to rinse the same way. That foreskin is still pulled back. If it's slipped over, we're going to pull it back. Make sure we're rinsing really well, going around in a circular motion. Now, one of the things I may do at this point is really inspect. We have pulled back that foreskin, and sometimes down in the very crevice of where that foreskin has been pulled back, you'll see a crystallization. A lot of times that could be dried urine. So you would take just the edge of your washcloth and just kind of go in there and try to just gently move that out. Again, kind of going in a circular motion, if you will. All right. And pat dry. Lift up the shaft of the penis. Dry underneath it. Head of the penis. Once it's nice and dry, we would retract that foreskin back down. Now we can move on to the rest of his peri area, concentrating now on the testicles. We're going to wash those very gently. If you need to lift the testicles to get into the peri area, we do that just like we do breast tissue. Gently rise it up. Go around in a circular motion. Washing. And at this point, I reach down as far into the peri area as I can. Far down into the rectal area as I can. And rinsing the exact same way. Now, one of the things that happens sometimes when we're doing up close and personal care, sometimes the signals get sent a little differently, especially with some of our gentlemen, and even sometimes with our ladies that have dementia. And sometimes you'll get maybe some inappropriate talk at this point, you know. And all I can tell you is the best thing way to handle it sometimes is just ignore it and move on. Just keep going. You know, I've had little hands come up sometimes. You know, when that happens, I usually don't give people eye contact. I usually don't get shook up about it. I don't reprimand the resident. I simply, if his hand has reached up and it happens to be on my breast, I give him eye contact and I move it down to my hip. And I just keep going. The message I'm sending, it's okay here, it's not okay here. And sometimes that'll happen. Or he'll say, you know, are you married? They'll ask you all kinds of funny things. And you just have to have a sense of humor and understand this is part of human nature. We're doing a very up close and personal thing, and sometimes it gets misinterpreted. Just do your best to just keep moving on. If this is something that is uncomfortable for you, or you feel the resident is a little too aggressive with this, you may want to always make sure you're in the room with another person, that you're never doing this skill by yourself. All right, so we've got both Mabel and Melvin nice and clean. And so we're about to turn them over here. Let's go ahead and take this off. Move that blanket back down. That's nice and wet, so we're going to get rid of that. And we're going to get ready to turn her and do their back side and start to remake this bed.